World Breastfeeding Week is marked yearly in the first 7 days of August. Figures by the South African Demographic and Health Survey show that the number of local mothers who breastfeed exclusively up to 6 months has increased, but it still hasn't reached the 50% mark. To discuss the importance of breastfeeding, we are now joined in studio by Dr Lesley Bamford from the Department of Health, as well as Anna-Marie de Beer, Medical and Scientific Affairs Manager, as well as Registered Dietitian at Nestlé South Africa. Good to have both of you ladies. Thank you for coming in.
Morning.
Hey, so we talk about the fact that we have increased. We're still below 50%. All these educational drives from the Department of Health and talking like we're doing this morning, is it helping?
Well, I think the data from the Demographic Health Survey certainly shows that the number of women who are breastfeeding and exclusively breastfeeding for the first 6 months is increasing. But as you quite correctly pointed out, we would really like to be in a situation where all mothers exclusively breastfeed their babies for the first 6 months of the child's life, followed by ongoing breastfeeding until the age of 2. And we know that if we could reach that situation, we would have a population of children who would survive better. We'd have fewer deaths from infectious diseases. Those children would also be far healthier, and they would be more able to benefit from, more able to learn, both in the early phase and when they go to school. There's increasing evidence that children who are breastfed perform better at school.
Really? Okay. Breastfed for how long? Because I know you're saying 2 years, and there's a school of thought that, anything after 6 months is truly, who is actually benefiting? Is the child benefiting or the mom benefiting?
Well, it is true that the greatest benefits of breastfeeding are in the early phase, that first 6 months, and particularly if it is exclusive breastfeeding. But the advantages certainly continue right up until the age of 2, even beyond. So we really encourage mothers to breastfeed for as long as possible.
Okay. From your perspective, we look at we look at formula, because there's always the argument between breast milk and formula. Some say, they give me just as much advantage as breast milk, but others don't. So you talk to us about it.
I think breast milk is absolutely the ideal way of feeding babies. And we also know, and I think I just want to add to what Leslie has said now, is apart from this early benefits of breastfeeding, it actually has long-term benefits. And we know that breastfed babies, when they're adults, have less risk of being overweight or having diabetes or even having cardiovascular disease. So I think it's really important that we really encourage moms to breastfeed really from the beginning. And when moms decide not to breastfeed, not to make that decision by themselves, but rather consult a healthcare professional, can speak to a lactation consultant to really make sure that there's no other alternative before she makes a decision not to breastfeed.
Yeah, I was reading quite an interesting survey, and it was just talking about the myths of breastfeeding. And one of the things it said is that when you look at formula, there's about 30 beneficial ingredients. But when you look at breast milk, there are about 300 beneficial ingredients. So if you weigh the two up against each other,
there's no comparison, and I think that's important.
And perhaps just to add, there's also the issue of affordability.
Yes.
And convenience.
Yeah.
So, and as children become older, the volume of milk that they require increases. And so formula becomes more and more expensive and less affordable for many mothers.
There, of course, also are mothers that do complain, and let's be realistic. It comes easy to some mothers and yet not to others. I'm one of the women that, with my first child, it really didn't come easily. My second was much better, but I really struggled with milk production, and it was a big effort for me. So, there is that reality to contend with as well.
Certainly, and I think increasingly we realize that for a mother to successfully breastfeed, certain conditions have to be met. The first is that the mother has to have knowledge, and she has to believe that she can breastfeed. But she also needs to be supported, and she needs to be supported in different contexts. She needs support from healthcare workers, but she also needs support from her family, from the broader community, and certainly for mothers who are working support from the workplace.
And if I can maybe add to that, I think within this World Breastfeeding Week that we're having currently, it's all about sustaining breastfeeding. What we realize is that in the workplace, there's quite a bit that we can do. And I think we've come a far way, but there's way more place for us to go in terms of creating areas for moms to be able to breastfeed. If there are creches in the workplace, I think that's a great way of making sure that moms can continue breastfeeding. But some of the other things that one can do is to have express rooms in the workplace where moms may not be able to bring their children with. But if she can sustain the breastfeeding by expressing milk during the day, feeding at night, she will go a far way and really a long way and keep on the breastfeeding, because breast milk really works on a supply and demand issue. So the more the demand, the higher the supply will be. And the moment the demand drops, the supply drops. And I think that's quite important to really help moms to understand that basic principle in order to sustain breastfeeding.
Sustain breastfeeding, and it's great for moms. I mean, I think moms are more comfortable feeding in public than the public is of moms feeding in public. When are we going to get away from this? I mean, there's still this massive debate about women feeding in public.
Certainly, it's a big issue, and perhaps I could then talk a little bit about our breastfeeding campaign. And I think the two issues that we're really touching on are, first of all, this issue of support. Focusing on this idea that mothers really need support to breastfeed. It's everyone's business, including owners of malls, etc. They need to make facilities available so that women can comfortably breastfeed in public. And then linked to that, this idea that really being able to breastfeed whenever, wherever is a right for the mother and the baby. So we have this campaign now. I've brought these along. These are tools that have been sent to some of our facilities and will also be used in different fora. And the idea is really to start a conversation about breastfeeding, to ask people what are they doing to support breastfeeding. Why are mothers in their community not successfully breastfeeding, given the fact that we know that of all the advantages associated with breastfeeding.
I mean, and women do, you still feel a little bit sort of, you don't want to breastfeed in public, you'll go to the toilet and breastfeed. And I mean, who wants to eat in the toilet? I mean, with all due respect, that's the reality of all of it. I mean, you'll hide away, you'll do whatever you can, and that's just not to, what's the word I'm looking for, to make anybody uncomfortable around you, but it is a natural thing. So I see that many other countries in the world, in fact I think I was just seeing now in Australia, there was a woman who was breastfeeding in Parliament.
Correct.
Yeah, you saw that as well. I mean, do you think we'll get there?
I think we will eventually, but what's very important, and I think all these campaigns are really important campaigns, but we forget sometimes that there's a whole society out there. What about boys, and instead of making breast sexual objects, it's actually a feeding object, and that people begin to understand it's natural. And I think we need to start in schools, we need to educate school children, not just the girls but the boys as well, that breastfeeding is normal, it's natural, and in that way they will be able to encourage one day when they have a partner who's felt pregnant, has had a baby, to be able to support the partner as well. And I think we need to look at the support that we provide from the community side. Very often, in the workplace, people will make derogative comments about a mom that's got to go and express milk quickly, or she starts leaking in the workplace. There's some funny things that happen.
Absolutely.
And instead of laughing about it, be encouraging and help the mom to, it's actually perfectly fine.
It's normal, it's natural.
It's normal,
These things
it's
happen.
natural, correct.
Absolutely.
And I think I do believe we'll get there, maybe not in the next 5 years, but hopefully
the more
in
we
the longer
educate
term.
and talk about it, the more natural it will become. All right, ladies, thank you. Breastfeeding Week, it's an international campaign. Use the hashtag. Let me read your hashtag there.
Yes.
Hashtag breastfeed today.
So people can pledge their support for breastfeeding. They can take a photograph with the peeler baby if they have one.
All right.
But they can also pledge support at that hashtag.
Excellent. Well, there you have it. Support it. Make it become as normal, as natural as it is, because it is a normal and natural phenomenon. And let's encourage breastfeeding as much as we can and assist those that are. All right. The time is 4 minutes before the top of the hour. We're going to take a break here, and I'm going to say